Hi, I'm Dr. Stephen Wilding. As parents of a child with cerebral palsy, or CP, you're already juggling so much, and we understand. This video is designed to make understanding hip surveillance a little easier. We'll explain what can happen with your child's hips and how we can work together to keep them healthy and strong. CP affects how the brain, nervous system, and muscles communicate. While CP is the most common neuromuscular condition, other conditions like spina bifida, muscular dystrophy, and others can also impact muscle control. Because CP is the most common, we'll primarily discuss it today. Children with CP are born with healthy hips. However, because of the way CP affects muscle tone and movement, their hips are at a higher risk of gradually moving out of the socket, a process called hip migration or displacement. Imagine the hip socket as a cup for the ball of the thigh bone. In hip migration, the ball slowly starts to slip out of that cup. This can happen in up to 1/3 of children with cerebral palsy. The tricky thing is it often happens slowly and painlessly at first. That's why regular checkups are so important. While there might not be any obvious signs at the beginning, untreated hip migration can eventually lead to pain, difficulty moving, arthritis, challenges with hygiene for caregivers, and an overall lower quality of life. But early intervention can make a huge difference. By catching hip migration early, we can often prevent it from progressing and avoid these problems. That's where hip surveillance guidelines come in. These guidelines, developed by the Pediatric Orthopaedic Society of North America, help us track your child's hip health. The first evaluation usually happens around age 2 or whenever your child is diagnosed with CP. It includes a simple range of motion exam focusing on how far your child's hips can move outward, or hip abduction. We'll show you what that looks like. This visit will also include an X-ray of their pelvis. Depending on your child's type of CP, whether it's mild, moderate, or severe, and their initial visit, we'll recommend how often they need follow-up checks. This might involve repeat range of motion exams and X-rays. The goal is to monitor their hips closely and catch any changes early. You'll be referred to a pediatric orthopedic surgeon if your child has any hip pain, a decrease in hip motion, limited hip abduction, or if the X-ray shows over 30% migration. If a referral is needed, we'll do a thorough assessment and discuss treatment options with you. These could include continued monitoring, minor procedures like tendon lengthening, or more involved bony realignment surgery. We'll explain everything clearly and answer all your questions. Our ultimate goal is to help your child live a full and happy life. We're here to partner with you every step of the way.